Hi, my name is Eduardo Alanis, and I'm with the Texas State Athletic Training Program. Today I will be doing palpations over the knee. The things I will be covering is the head of the fibula, the pes anserine attachment site, the biceps femoris tendon, the medial and lateral meniscus, and the medial and lateral collateral ligaments. And my lovely partner today will be Dolores. So let's get on to the palpations. Before palpating anyone of the opposite sex, you always want to get their permission to touch them. So do I have your permission to touch you? All right. We'll start off with the medial and lateral collateral ligaments. So what you would want to do is look for the reference point. And the reference point would be the tibial tuberosity. So the tibial tuberosity is right at the end of the patellar tendon. It's a bony protrusion. Then you can go laterally to the side to locate the head of the fibula, which is right here. It's a pretty bony knob. You can usually do a circle around it when you find it. And this is where the lateral collateral ligament will attach, and it will also attach at the lateral epicondyle of the femur. One way you can do this is by having the patient place across the leg over the other one, and you just find the head of the fibula and the lateral epicondyle of the femur, and you can strum around here for the ligament, and it should be about the width of a pencil. It should feel like there's a pencil in there. So that's it right there. And then to find the medial collateral ligament, again, you'll look for the reference point with the tibial tuberosity. You can go a little up into the meniscal windows, follow the joint line, that's right here, and locate the epicondyle of the femur again, and the head of the tibia. And you can usually strum horizontally to find the broad band of the MCL. For the meniscus, you can put your thumbs right here in the meniscal windows, and the meniscus sit right on top of the tibial plateaus. So if you palpate just superiorly of the tibial plateaus, you should be able to feel the medial meniscus. They're kind of hard to palpate for because they're not injured right now. If they do suffer an injury, usually you'll have pain within this joint line or built up fluid within it. But another way to palpate the medial meniscus is you can take your other hand and grab the lower leg and have the patient relax, and you can internally rotate the tibia, and you should feel a slight outward protrusion come out from under your thumb. It's very light, you won't feel it too much, but it's there. And then the lateral meniscus is right along the joint line as well. That one's a little bit harder to palpate. Next we'll have the pes anserine attachment site. So the pes anserine attachment site, the three things that you have to remember about the pes anserine attachment site is the three muscles that attach there. And you know that by the acronym SARGENT, which stands for sartorius, gracilis, and your semitendinosus. So you'll locate the tibial tuberosity, and you'll go immediately about an inch until you feel a flat surface, and that's your pes anserine attachment site. The next thing we have is the lateral tubercle, or Gerdy's tubercle. Again, you'll locate the tibial tuberosity, and you'll go laterally this time about 2 to 3 inches, and a little bit superior, and you should feel a little bony, not too big or anything, but that should be Gerdy's tubercle right there. And then the last thing I have is the biceps femoris tendon. So one way you could do this is have the patient lay on their side, And what you can have them do is passively flex and extend the knee. That's gonna differentiate between the vastus lateralis and the biceps femoris tendon. So when the patient flexes the knee, the biceps femoris tendon will fire off, and you can pretty much grab the tendon with your thumb right here. If you want to get a close up right here, you see I'm actually grabbing the tendon right here. And that is the conclusion of this video. Thank you for watching.